Day 9 and a glimmer of hope as the ACT records just 8 new COVID-19 cases, and not a single one was infectious in the community.
This is the lockdown working.
There are now 102 active cases of COVID-19 in the ACT. Only 2 remain under investigation, including the first identified case that sparked the lockdown last Thursday. The list of exposure sites is now nearing 300, with a raft of stores at Belconnen and Westfield added today, as well as this childcare centre and the Woden bus interchange. Transmission of the virus has been confirmed at 8 locations across Canberra. 29 cases can be linked to Lyneham High, 20 to the Fiction nightclub in Civic. The Southern Cross basketball stadium cluster has grown to 14, while 8 cases are connected to the Lennox Jaguar dealership in Phillip. 7 cases are linked to the Downer Community Centre and 4 are connected to the Assembly Bar in Braddon. 3 cases can be traced back to the Belconnen basketball stadium, and the Gold Creek school cluster remains at 2.
We also now have 2 cases in our hospitals. Neither of them are requiring intensive support or breathing assistance. And while they are COVID-19 positive, they are not in hospital for COVID-related issues.
Recording new cases in the single digits is a welcome change, but there's a catch.
Now, we're introducing an 8 p.m. cut-off on case numbers. This allows us to provide the details on cases who were infectious whilst in the community.
That means the ACT recorded 8 new cases up to 8 o'clock last night. Any cases recorded after that will be included in tomorrow's figures.
It does mean that today's case number is probably a little artificially low, and tomorrow we'll be back up to possibly what we were seeing yesterday or the day before.
Overrepresented in the numbers are young Canberrans, with 7 schools now caught up in the outbreak.
Yeah, look, it's the phone call you never want to get and never want to have to take.
Shocked, and then that quickly turned to concern for the members of our community who were positive with COVID.
40% of Canberra's cases are under 17 years of age. 46% are between 18 and 44.
That fact is quite concerning, for someone who's in education. It really just shows that we've got a vulnerability.
There's no question the answer is vaccines. And the Chief Minister says work is well underway to start vaccinating younger Canberrans soon, providing he can secure the supply.
We want to be in a position to vaccinate as many 12 to 15-year-olds as possible before the end of the school year.
As a father, and a father of teenage children, that sounds like great news.
But it's hoped primary school children aren't left behind.
We know that younger and younger children are vulnerable with catching COVID and also suffering the effects of COVID as well.
When it comes to Delta, none of us are safe until all of us are. Rosie King, ABC News, Canberra.